Okay.
Hi everyone. We did the meningococcal meningitis. My name is Olivia.
And my name is Mireya. So we're gonna start with the name of pathogens, which the first one is Neisseria meningitidis, the second one is Streptococcus pneumoniae, and then the third one is Haemophilus influenzae. So in here, is showing the type of morphology of the pathogen, and this disease is a gram-negative type of Staphylococcus bacteria. So the first image is showing the Neisseria meningitidis, and then the second one is the Streptococcus pneumoniae, and then the third one is the Haemophilus influenzae. So the next part is we're gonna talk about the mode of transmission. So this disease is spread through close contact with an infected person's respiratory droplets, and such as when they cough or sneeze, even in kissing, sharing a drink, and living in close quarters. And but surprisingly, this disease is not highly contagious and it's not easily spread by sharing food, drinks, or cigarettes. But saliva can inhibit the growth of the bacteria. Some ways to reduce the risk of spreading this disease is by cleaning and disinfecting frequently in the touched surfaces and maintaining good indoor ventilation, and also by avoiding crowded or poorly ventilated public places, even by wearing surgical masks to help a lot in crowded places. And in this part, we're going to talk about the signs and symptoms of the disease, which it's high fever, headache, stiff neck, nausea, vomiting, rash, or even changes in behavior. And by changes in behavior, what it means is that it could give you like a lot of sleepiness, or it's like really hard to wake up. You could also get like joint or muscle pain, or even no appetite or thirst, and it could even lead to seizures.
So, how do the bacteria do the damage? So, the bacteria strain of the meningococcal meningitis, once it crosses the blood-brain barrier, it will house itself inside the cerebral spinal fluid, and from there they can really multiply quickly. And since it's an endotoxin, once the bacteria lyse and die, the toxin LOS is released, and it can cause inflammation and swelling in the meninges part of the brain. And the inflammation and swelling will result in the different symptoms that Maria mentioned, like stiff neck, irritant and bright lights, confusion, drowsiness, headache, delirium, and seizures. So the mortality rate is a little high based on how rare it is. So about 10 to 15% is the mortality rate. However, in last year in 2023, there was a spike of 18% mortality, and one in every 20 people who contract meningococcal meningitis will die. For the distribution, the bacteria Neisseria meningitidis is found in the back of the nose and the throat, and actually one of every 10 people actually have this bacteria, and they are able to live with it without having any signs or symptoms of the infection. And however, the bacteria itself is an opportunistic pathogen because once it does leave the nose and throat area, it will infect the lining of the brain and spinal cord and cause meningococcal meningitis. For treatment and prevention, for treatment, it's really important to quickly give treatment to the patient or diagnose them in order for them to get the best chance of a good recovery. If someone is going to be treated with meningococcal meningitis, they need to be put in the hospital setting to receive the medication. They get steroids, antibiotics, and also they might be needed to give oxygen once they are actually um, admitted into the hospital. And the recovery for this is about 7 to 10 days. They can be in the hospital. Some people also get discharged a little bit early as long as doctors are seeing that they're recovering well. And if you are someone who actually brings the patient to the hospital, you yourself will have to be given some sort of antibiotic since you were in close contact with this person. Prevention is vaccination. There are three different kinds of vaccinations. There's the meningococcal conjugate, the serogroup B meningococcal, meningococcal and the pentavalent. And for the ages, they recommend that preteens and teenagers get the vaccines, and anyone else who is at risk to receive this bacterial infection, they can also get the vaccine as well. So, my interesting finding that I found regarding this infection is that you can do a self-check at home if you are concerned that you might have meningococcal meningitis. You can have your chin touch your chest. And if you're able to do that, then you're good. And if you're not able to, or it feels like it's impossible, you might want to be checked out because stiff neck is one of the symptoms of this bacterial infection.
And then what I found was that this meningococcal disease is rare and it's a serious illness caused by the bacteria Neisseria meningitis, which is the cause that it makes the brain and spinal cord have some infection, and it can also cause blood infections. And I also found out that one out of the 7, 10, 40% of those who get the disease, they die eventually.
And that's it.
Thank you.
Thank you.